So when you look back on all your years in psychiatry, and you've been at Albany Med this whole time,
Yes.
what stands out to you? There's obviously this huge stigma against mental illness. Have you found it difficult to treat patients that come into the hospital with mental illness?
Well, in many ways, yes. We have no trouble treating them here. The problem is when they leave, it's hard. The number of beds, psychiatric beds have dropped. Um, Referrals are hard because it's hard to get outpatient referrals for lots of reasons. Insurance coverage, not as many providers, and there's a lot of reasons for that too. Everybody was kind of overwhelmed 50 years ago with Willowbrook. Everybody thought, oh my God, this is terrible. So we thought everything would change, but it didn't. In 1963, they had the whole Community Mental Health Act where they were talking about deinstitutionalization. And we thought it was going to work, but it led to homelessness and incarceration and everything else. And then in 93, in New York, they did the Community Mental Health Reinvestment Act. And we thought that was going to work. And of course, it didn't. So funding has been a problem. There's no question. Even though there have been several very powerful incidents that occurred in '99, the young girl that was pushed in front of a subway led to the Kendra's law, which you've heard about, which brings people into the hospital when they don't take their meds. And then there was the in 2007 the Jonathan's law, where a young kid who had developmental disorders died under the hands of someone. I'm not sure which. So we all thought that that would improve everything, but indeed, many people in this state, like over 3 million New Yorkers, live in areas that have mental health shortages. And that's nationally as well. I mean, when you think about it, mental health services funding only takes up less than 3% of national health budget. So it's a national thing, not just a New York thing. And then, of course, Andrew Cuomo decided that it would help mental health by getting rid of psychiatric hospital beds, and that was a bad idea. Right now there's probably 1,000 seriously mentally ill patients who are in jails, and they shouldn't be in jails.
Mhm.
So I think investment has been a problem, and it's really unfortunate. Over half of people with mental health conditions in this country don't get treatment for lots of reasons. And then COVID came, and then the whole thing with social media has led to all kinds of mental health issues, which all brings us back to stigma. And stigma's been around for centuries, of course, but it's not, it's because people don't understand mental illness. And look at me. I mean, I was in surgery, and I spent time in psychiatry. I said, wow, this is an experience. It's wonderful. It's helpful. It's insightful. And yet, unless you have a family member who has a mental illness, or you are not involved in the field, you don't really, many people don't understand it. And the stigma, which means a brand, it goes back centuries, for people who are branded in a way as being bad, or being sick in a way that they are controlling, which of course they're not, has led to just accentuating all the other issues, including funding, support. We don't have the big advocates, funding for a certain disease that we see in other fields, and it's really tough. And I think it's put a lot of pressure on our providers too, because the insurance companies haven't invested as much in it. So our providers, they're overwhelmed. They get little insurance coverage. Some of them leave the field. So it's time for change. We said it 50 years ago, but my heavens, it's
Well,
time.
how do you think that we can try and improve access to treatment and care? Obviously, funding's the big thing, but what do you think we need that's feasible in the next decade to help improve the system?
Mostly education. Isn't that interesting? You would think that would be obvious, but teaching people about mental health, teaching people that not only is it not something people do volitionally, but it's treatable. And a few years ago, there were a bunch of celebrities who spoke of their mental illness and how it worked, and it really helped for a while. People got on the news and said, "I have depression. I was treated. I feel better." And that kind of education is so powerful, because people listen and they go, wow, this is a person I've listened to on TV or whatever, and they have a mental illness and they've gotten better. But education is important. I think that's what some groups like NAMI have done to help educate the public about the nastiness and the silliness of stigma, and improving through our legislators subsidies to help fund the treatment of the mentally ill. But again, mostly education will be the best. I really feel educating the public.
I think that depression and anxiety are a little more accepted than these more serious mental illnesses. So yeah, I can understand why you feel like education is going to help. And that's really the key to ending the stigma against mental illness, right? These people they just don't know. But I mean, you speak about there being a lack of beds. And my understanding was that a lot of these institutions were closed over the past like 3 decades, right? And that has led to a decrease in the workforce in
Yep.
mental health.
Mhm.
And maybe people in mental health don't feel like they're compensated appropriately. And I mean, so I feel like increasing the number of beds, maybe increasing the workforce. I mean, what are some of those things like literally in the industry that need to improve? I mean,
Well, again, you're right. I think because of the lack of beds and availability of places for patients to go, even briefly, has led to homelessness, incarceration, um, living on the streets. It's horrible. I mean, you know, we have trouble getting our patients into facilities when they really need it, and they may sit in our emergency rooms or on our medical floors until we can get those beds because they have diminished. In addition to them diminishing, the number of patients needing help has increased over time because of various stressors, including, as I mentioned, the whole issue with COVID. And we're seeing a lot of kids who were stuck at home and they were getting into social media, which has been kind of a good and a very bad thing for children. So we need not just only more beds, but we need our um, politicians to understand it and to start funding um, to increase the number of beds and to increase insurance coverage, which has been a problem too. Some companies have come through, others have not. But whenever I get a call saying, can you help me refer a friend or a family or a patient? First thing I have to ask is what insurance do they have? And then I work from there to find people that will cover that. That shouldn't be a question that I have to ask, it shouldn't be.
so do you feel like one of the big barriers for these families who you work with day in and day out is insurance and how they're going to pay for this, where they can find treatment?
Sure, that's part of it, of course. Yes, yes, that's definitely part of it. No question.
What stands out to you with all these families that you've worked with over the years and spoken to? What do you feel like their biggest challenges are?
Well, I think the biggest challenges is in the home, dealing with their family member's mental illness. That's a huge challenge. What do we do with it? Are they at risk? Are they danger to themselves or other people? Are they so sad that they're not getting help? That's very powerful. But then the next part, of course, is what can we do about it? And family members get very frustrated, and so do patients, when they can't get help or if they have to wait for 2 months for an appointment. Um, that kind of thing is so terrifying. Can you imagine if you had appendicitis and they say, well, I'll see you in a month? Well, this is just as urgent. I mean, truthfully, this is just as urgent. And I try to convince people about that all the time. And they'll say, well, wait a minute, it's a mental illness. No, you don't have time. These are urgent needs that need to be met and need to be met as soon as possible.
That danger to themselves or others, I feel like it's a very loose definition.
Yes, it is.
Oftentimes with the mobile crisis unit, you have to be strategic in what you say and almost kind of embellish the situation in order to get them to come out and respond. I don't know. I'm not sure how can you make that better so that during a time of crisis, you don't have to wait for something to happen, but instead prevent it, call mobile crisis and actually get them to respond. Because in my situation and from attending support groups, I think a lot of times mobile crisis can be very challenging to actually get them to actually come out and respond.
Yeah. Well, there's all kinds of legal parts to that, forensic aspects to it as well. But we have to remember that when we say danger to self or others, it doesn't always mean suicide or homicide. A danger to others or self could mean they're so depressed that they're not eating properly. They're drinking, which is dangerous for some people, or they're not going to work, and that's going to lead to other issues for the family. In a way, that's a danger too, not just suicide and homicide. So we have to expand, like you said, our views of what does it mean by danger to self and others. There's more than just the risk of death.